Sure.
Hi, everybody. Keep signing in. Some of my most faithful participants have already signed in. There we go. There we go. Now they're popping up. Hi, everybody. Good afternoon. Okay. Looks like a few more are trying to join. Here we go. Okay. Well, welcome everybody to today's session of the community table. We have Dane Preston from KIAR, and I'm going to let him tell you what that stands for. And I'm excited he's here today because this is a topic that a lot of you all have asked about. What is a recovery house? How do I know if my client qualifies for one or should go to one? And then if they do, how is the best way to access and help the client apply? So, if you have questions or a comment, you can raise your hand or put it in the chat, and I will monitor that and make sure that Dane knows that somebody has something that they want to say or ask. And he said that he wants it to be collaborative and he welcomes these interruptions with questions and comments. So I'm going to turn it over to him now and let him talk to you about what all is going on with Kentucky recovery houses.
Awesome. Well, thank you so much, everyone. I'm really excited to be here. Again, my name is Dane Preston. I'm the executive director of the Kentucky Alliance of Recovery Residences here in Kentucky. And let me, if I can share my screen. I do have a little presentation I can do. So, give you a background just on on what KIAR is. Let me see. There we go. KIAR is, like I said, is the NAR affiliate for the state of Kentucky. What NAR is the National Alliance for Recovery Residences. It is the national organization that sets the standard for certification for recovery housing. Then individual state affiliates act sort of like franchises, and they utilize those standards and operationalize those standards for certification. Kentucky did pass a law back in 2023 which requires certification for all recovery residences, and the organization has to be approved by the Cabinet for Health and Family Services. Currently, KIAR is that organization that is approved by the Cabinet for Health and Family Services to perform those certifications around the state, which yeah, we have over 300 certified houses, over 4,000 beds that are currently certified in the state of Kentucky, making us one of the largest affiliates and most robust recovery housing landscapes in the country, which we're very excited to be a part of. Um, for you guys, probably the big question is, what is recovery housing, and what does that mean for the individuals that you're serving? Recovery housing, recovery residences are a safe and healthy, family-like, substance-free living environment that supports individuals in recovery from addiction. They are different than residential inpatient treatment centers. Residential inpatient treatment centers, for those familiar with the Brook or the Ridge, Landmark, now called Painted Grove. These are short-term, usually around 28 to 30 day centers that someone's going to in order to get stabilized so that they can then transition out into a recovery residence. Their specific purpose is to assist an individual in building recovery capital over an extended period of time. And I'll get to recovery capital in a few minutes. I just want to briefly talk about what certification entails. So in Kentucky, the way we do certification is over three phases. Initially, someone will apply for certification, which has a just brief informational form about who you are, what your organization is, how many houses you're applying for, what levels you're applying for. which when we'll respond to and have you fill out some preliminary documentation, which we call our phase one documentation, which is verification documents. At that point, we're ensuring that you have appropriate liability insurance for that of a recovery residence, that you have signed the KIR grievance policy so that your residents or your staff can, in the event that there is an issue that they feel can't be handled at a local level, they're able to file a grievance with KIR directly. That you have permission from the property owner of record to operate a recovery residence at that specific address. That is actually a regulatory requirement that we have to receive, and that you have signed the NAR Code of Ethics. And that you have signed and notarized an attestations document that you're in compliance with all local zoning and code enforcement regulations. Once you've completed all that documentation, or recovery residence has completed all that documentation, we transition you to phase two of the certification process. That phase two is the policy and procedure review part of the process, and that is the most collaborative part of the process. That's where we have you submit all of your written policies and procedures uh, about how your program is run so that we can review them, provide you notes on them, schedule meetings so we can provide technical assistance with them, and help you kind of raise your standards or assist you in meeting the NAR standard. Um, we operate as a regulatory body just by definition, since we are a certification organization, but I like to frame it as certification is a byproduct of what we do. We're really a health and human services organization where we are helping people raise their standards, providing technical assistance during this period so that certification is not something that is hidden. It's not something that is not accessible, that we make it as accessible as possible, but we're here to provide our knowledge and assist people in getting through the process. We do ask for 32 individualized policies that cover everything from administrative operations to recovery support to being a good neighbor. Um, It is the longest part of the process. It can usually take a few months when someone has initially submitted their documentation to us, reviewing them, providing notes, and then doing the back and forth, the meetings, and then eventually getting someone to where they have submitted policies that do meet the NAR standard. Uh, once we have once we have policies that have met the NAR standard, we then schedule a site visit. That is when KIR staff will come out to the physical property itself and inspect everything to ensure that space requirements are met. The specific NAR standards are 50 square feet in each bedroom. That does not include closet space. In that bedroom, there will need to be a nightstand or equivalent, dresser or equivalent, and a place to hang clothes for each bed. We can be a little bit loose on that when we're doing on-site inspections, where it's why we have the or equivalent verbiage in there. This way, if someone wants to, for example, we've done an inspection where they had bunk beds, and what's the point of a nightstand that's on the ground for the person who's on a top bunk? And so this operator put shelves on the walls. This way, the individual who was residing on the top bunk was able to utilize what would have been a nightstand for the bottom bunk, but on the top bunk. So we appreciate and respect creativity when it comes to those things. As we're doing the site inspection, we're looking to see how medications are stored. Are they stored in a safe manner? Are house managers being utilized properly? And this is a chance for us to educate and provide TA on technical assistance on how medications can be stored in relation to the house manager. We've run into situations where the house manager, who may just be a resident who is getting free rent or discounted rent, is being charged with holding on to narcotic medications for other residents. And we have to talk about the legality of that situation and how to better store medications to assist individuals in building agency so that when they do transition out to independent living, they have a better chance of success. We're also looking for cold storage to ensure that there is enough refrigerator and freezer space in the residence to accommodate the number of residents. Our specific standard is 3 cubic feet of cold storage for every resident. That usually accounts for six. Your full size, your regular full size refrigerator is generally 18 to 24 cubic feet. So that can accommodate between 6 and 7 residents. If there are 10 residents, they would need to have a full-size fridge and they may have a chest freezer or something along those lines. We're also looking for places for them to share, the residents to share meals in, for them to congregate in, to watch movies in, if there's a living room, that the living room hasn't been turned into a bedroom, things along those lines that you would find in a single family residence. Once we've done that inspection, usually takes between 30 and 40 minutes per residence. We will talk with the staff and talk about what the policies that were submitted, kind of go through what it's like to be a resident there, so that one, we can ensure that the written policies that they provided are in alignment with what was actually submitted, or what the actual practices of the organization are. But it's also where we can talk about how practices may be able to, we may be able to find efficiencies, or may be able to share some experience on how we've treated different situations in the past, so that they can better serve their residents. Once all that is completed, we send what we call a quality improvement plan to the operator. That lists all the, maybe it might be minor repairs, it might be they need to remove certain beds, it might be they need to add a refrigerator, it could be a litany of things that we found in the physical properties. We send that QIP, quality improvement plan, to the operator and then receive back a mutually agreed upon plan of correction with relevant timeline for each residence. And it's very important for us that that is a mutually agreed upon date. We give you up to 60 days to remediate things, but we leave it to the operator to determine when they'll be able to fix everything. We do understand that these places do operate. They're a self-pay model. Generally speaking, is a self-pay model, very different than licensure for, say, a hospital, which is all going to be insurance paid. It's a little bit more difficult to fund things in a self-pay recovery residence, so we do try to give some leeway on when they'll be able to remediate. It might be minor repairs, it might be buying a refrigerator. But with that mutually agreed upon date, we will allow them to send photo evidence of each remediation, at which point, once everything has been remediated, we send a certification compliance agreement, which is the final component of the certification process. It is a reiteration of all the NAR standards, an explanation of their duties as a certified recovery residence operator, notify us about any violations of the code of ethics, that if they change levels, that they have to notify us, if they're going to be closing a house, they have to notify us 60 days prior to closure, as well as informing the residents and then enacting a transition plan, just ensuring that at no point the operator is not aware of their duties and responsibilities to both the affiliate and their residents during that process. Once that is signed, we then send a printable certificate for each residence, with an individualized certificate number, number of beds, address, the whole 9 yards, that they're able to post that in the residence. This way, their residents know, and city officials, if they're ever coming out to do an inspection, are able to see that this place is certified by a credentialing agency that ensure that they meet the NAR standards. I know it's a lot with the certification process. It on average takes 177 days to go from application to certification. It is a very robust process, and we are very proud of this process and the places that do come out better on the other side. The way I know this is very important for the case managers and discharge planners that are on this call, regarding how do I know what recovery residence to send one of my clients to, one of the people under my care to? Now, NAR identifies four different levels of recovery residences, level one, two, three, and four. Now, in Kentucky, we operate a little bit differently than most other states. We actually combine three and four, but I'll talk a little bit about each level, so that if it does come up, for one of your clients, you're able to kind of direct them in the proper to the proper channels. A level one is going to be your lowest level of accountability and supervision. Level one is peer run. Similar for those on the call who are familiar with Oxford House and the Oxford model, where there's no paid staff on site, that they are democratically run, that the residents themselves control who's doing the chores, making sure that rent's paid. There will be drug screening, there will be house meetings, but it's generally these are going to be operated at a single family homes with essentially imagine uh, a group of roommates living together who have agreed to be sober. And then agreed to hit a certain number of AA meetings a week and agreed to drug testing. That will be your level one. Level two is the next level up, also known as a type M for monitored. That involves at least one compensated staff person, and the barrier for this is extremely low, where that compensated staff person could be a resident that just gets free or reduced fees, could also be, say, a peer support that works for an office that then goes out and checks on this residence every day to ensure everything is going the way it needs to be, hosting the house meetings, ensuring that all the residents have what they need. It's going to be, and because of that additional staff member, because of that additional oversight, it's going to have a little bit higher degree of accountability than your typical level one type P for peer run recovery residents. After level two gets up into your more organizational hierarchy type recovery residences. In Kentucky, like I said, we combine threes and fours. A level three recovery residence in Kentucky is defined as having organizational hierarchy. So there'll be a director, there'll be a housing manager, and there'll be someone who's on site. And that person who's on site is generally credentialed, and that credential is usually a peer support. And then the level three can be demonstrated by either clinical programming as a requirement of the residents where the residents are in IOP or PHP or OP as a requirement of residency, or the recovery residence is providing non-billable, non-clinical life skills training like budgeting, anything along those lines. But in that level three recovery residence, yeah, you're going to see organizational hierarchy. You're going to see more formalized businesses than in many of your ones and twos. You're also going to see a little bit variation in the types of buildings these will be in. In general, level one and level two are going to be in single family homes or apartments. It's just generally what you'll see. Level threes are going to be in a little bit more of the facility-like end of the spectrum. For those who are familiar with the Recovery Kentucky centers, those are considered level three type S recovery residences. In Louisville, the Healing Place, the non-clinical part of the program is considered a level three recovery residence. Now, in other states that do level four is a service provider. It is akin to a 3.1 ASAM 3.1 residential treatment facility, but it could also be just a recovery residence that requires clinical services condition of residency. As I've said, we do combine three and four in the state of Kentucky. Now, what's the purpose of recovery housing? Why do we put effort into this? Why is it important to refer people here who do suffer from substance use disorders so that they do have a better chance of success? And where does the efficacy lie in recovery housing? And that is based on the social model of recovery. This is the core philosophy of recovery housing, that recovery happens best in mutually supportive community of peers. Now, how this works is individuals with a shared disability, in this case, it is recovery from substance use disorder, are choosing to live together and support each other in their recovery, where have a degree of governance over how the house is run. They're providing mutual aid to each other so that they are supporting each other in their successes, but then also supporting each other in their challenges so that they don't go back out. They don't end up experiencing a return to use. Um, that there are mutually agreed upon recovery plans where the residents themselves are taking ownership of their recovery. And that's very important that they're able to build agency while they're in these places. That's how these places are able to demonstrate their value and have their value because as someone is building that agency in that process, they take ownership of their own recovery. And in an authoritarian environment, someone doesn't get, is robbed of the chance to build that agency. So that is something that we do try to talk about with operators as we're going through the certification process and actually require a very specific policy on social model principles of what does a house meeting look like for this recovery residence? What is taking place there? What does accountability look like to where residents are holding each other accountable, but also holding themselves accountable? It's one thing for residents to hold other people accountable, but it's also extremely important that they're able to hold themselves accountable where it doesn't just become a game of finger pointing. That's where we get a chance to really educate operators on what our experience have been like. Right now, KIR does have only two staff members, but we're both in long-term recovery. We've also both worked in recovery housing. So we do come from a place of experience, not just a place of you should do this because we told you to do this. Lastly, the last element of the social model recovery is community involvement of ensuring that the recovery residence is promoting the residents becoming involved in either, the AA community, the NA community, Celebrate Recovery, Smart Recovery, whatever mutual aid they decide to be a part of. If they're promoting those behaviors and promoting them in a positive way so that these individuals are becoming tax-paying positive members of the society and the community from previously when they were in active addiction where they were a draw on society. Now, what are the general services that a recovery residence is going to provide? And this is just a big word cloud of a ton of different things that they end up providing. Regardless of billability, their recovery residents are going to be providing a form of case management of ensuring that there are connections to different community services. In general, I always like to ask, what's your first 2 weeks like when you move into a recovery residence to an operator who's seeking certification to see that they are assisting someone in applying for SNAP benefits, that they are applying for Medicaid if this person is eligible for Medicaid, that if they need psychiatric services, that this operator has developed community partners where they're able to refer out to psychiatric services. Have you developed relationships with different staffing agencies in your area so that you can find employment? Or as we run into in a little more the more rural parts of the state, have you developed relationships with the actual employers around so that you can send people out? Because that's one thing that, and we hear this all over the country, that when people, after cessation of use, people who suffer from SUD make some of the best workers out there because they're willing to put 110% into their jobs. Other services that a recovery residence is going to be providing is if this person is on MAT, a medically assisted treatment, are they providing transportation to a methadone clinic? Are they providing referral to a doctor who's able to provide to prescribe them Suboxone? And lastly, one of the most important things that they're doing also is doing those mutually agreed upon recovery plans where someone is sitting down with that resident and going over their goals, going over their short-term goals, long-term goals, but also creating action plans around them that are attainable, that are asking that resident, well, are you sure this is something you can do in 30 days? What do you want? How are you going to reach that in 30 days? Is this something that could be a 60-day goal? But going through that process with them to ensure that they're able to actually get to where they need to be in order to increase their recovery capital. So, what is recovery capital? Great question. Recovery capital is the absolute baseline. It is the sum of everything that someone needs or has that is supportive of their recovery. And there are negative forms of recovery capital as well as positive forms of recovery capital. And the purpose of recovery housing itself is to provide a safe and supportive living environment for an individual to build on that recovery capital.
Dane,
Yes.
excuse me, there was a question that came up about can residents have pets?
So it depends on the recovery residence. There's no standard for NAR that prohibits people from having pets, and we've been to places that have dogs, been to places that have cats. Now, when you get into emotional support animals and service animals, um, you can potentially get into some fair housing and ADA issues if you deny someone a reasonable accommodation to have those pets. Hope that answers the question. And then specifically in Kentucky, emotional support animals are treated the same as service animals for those purposes. There are some documentation, and I can't remember the statute off the top of my head for this, so apologies, but you can definitely look it up on what documentation can be requested from an individual who. Um, for an operator, if an individual does request to bring their emotional support animal or service animal, what documentation can be requested of them. Now, understanding recovery capital is, like I said, it's the breadth. It is everything that is going on in an individual's life that is either supportive or detracting from their recovery. It is generally separated into a few domains, specifically personal recovery capital, social recovery capital, and community recovery capital. It's a way to break down how to help someone because it's very easy to see someone coming into a recovery residence and the operator saying, I'm going to treat you with love and I'm going to support you in your recovery. Well, understanding recovery capital allows an individual, an operator, to break down the different aspects of someone's life to see how they can best serve them. Give you an example about personal recovery capital. Do they have access to stable housing? Most likely not. If they're going to a sober living house, they're generally going to be at risk, of exposure to homelessness or risk of homelessness or risk of unstable housing. Do they have an increased risk of exposure to triggers? It could be their family members. It could also be their health, where they need to remove themselves from their and this is one of the toughest conversations you can have with a resident is talking about removing themselves from their immediate family for the time being so they can work on their recovery. Some examples about social recovery capital. Do they have a network of individuals in recovery that they're able to call upon when they do feel triggered or they do feel a desire to use or drink? Uh, Something that is talked about in many mutual aid meetings, and I like talking about it in presentations like this, is that the opposite of addiction is connection. And rebuilding positive social connections and replacing them from the negative connections that were built in active addiction is how someone is able to build that social recovery capital. So how is that operator connecting individuals to mutual aid meetings? How is that operator connecting people to sponsors, mentors, role models? How is that operator ensuring that this person is, and that goes along with employment as well. How is an operator connecting someone to rebuilding their social network? And then community recovery capital. Do they have access to vocational services, educational services? Maybe this individual wants to go back and get their GED. Maybe they want to get an associate's or a bachelor's degree. Are they being connected to those services? Is this individual struggling to find, if they're coming off of fentanyl, for example, and this person wishes to be on Suboxone as in order to help them during the early stages of their sobriety, is this person being connected with those services? And one of the other domains that's not on here is cultural recovery capital. Um, how is this person? what values are being promoted in this individual, which could be as simple as responsibility of doing one's chores. It could be honesty. That like there are ways for an operator to promote cultural recovery capital in an individual. This is just more kind of the same thing. Again, recovery capital, the breadth and depth of internal, external resources that can be drawn upon to initiate and sustain recovery. And the as I said before, the efficacy of recovery housing is really based on how they're able to help an individual increase their recovery capital. And the greater levels of recovery capital and social supports are related to significant improvements in psychological distress, self-esteem, and quality of life, which in turn are related to longer recovery duration. And that longer recovery duration is extremely important because, as we'll see on this next slide, is the increase in recovery capital does change over time, and why it's so important for an individual once they've been stabilized in residential treatment to go into a recovery residence that incorporates what we call resident-driven length of stay, which means that the resident is not required to leave after a predetermined period of time that could be determined by insurance providers, or it could be determined by the operator, that the resident is permitted to stay in recovery housing for as long as they are benefiting from that house and their recovery needs. To give you an example, I stayed in a sober living house for 3 years prior to moving out. And what this graph is showing is how the increase of recovery capital uh, goes during after cessation of use. So as you can see, during these first 0 to 3 months, the fire is out, the calm. You see a high increase of recovery capital where at the beginning someone was in active use and now they've immediately gained all this stuff back. They've gotten employment. Their family might be talking to them again. They may have gotten an ID for the first time in several years. They have their SNAP benefits. They have their Medicaid. They might be involved in treatment. They might be involved in outpatient services. They're getting all this services, getting all this stuff back. But then you see this dip right here between 4 and 12 months. Now, this is extremely important to recognize here because this is where people are at some of the highest risks of relapse, of return to use during this period of time, because after they've gotten all this stuff back during the first few months of recovery, now kind of starts to plateau a little bit, and then people can get stagnant a little bit. And this is why it is so important that they are able to stay in a recovery residence for that 12-month period, that 18-month period, so that when they're fighting this dip, both mentally, physically, spiritually, and all their domains of recovery capital that might see this dip, that they're in this supportive environment so they do feel safe and that they're at a lower risk of experiencing a return to use. And then as you can see that as they continue to be supported and build that community, personal, and social recovery capital over time, they're able to increase their recovery capital and then over to stable recovery, which is 5 years. And something that's very important, I don't have this, I don't have the graph on this specific presentation, but something that's extremely important to recognize is that, and this study was done initially through not the Recovery Outcomes Institute. Oh, I can't remember off the top of my head. Did a study on how long it takes for an individual after they stopped using to reach the same quality of life as an individual who never suffered from substance use disorder, and found that it was 15 years for them to reach that baseline, that 85% chance of maintaining long-term sustained recovery, essentially a 15% chance of um, being at risk for developing a substance use disorder. What they found was that for an individual who is engaged in community-based recovery support services like recovery housing, that they reach that same quality of life in 5 years, which is incredible to have reached that essentially 10 years quicker, so 3 times faster than an individual who didn't take part in that those community-based recovery support services like recovery housing. Now, in Kentucky, there is not a ton of data on recovery housing. We are hoping to broaden that over the next couple of years. We did apply for an opioid abatement grant for a 3-year study utilizing a recovery capital assessment. to be able to demonstrate the efficacy of recovery housing specifically in Kentucky. But we do get a look at Oxford House, and Oxford House has done a spectacular job nationwide at measuring not necessarily recovery capital, but looking at how their residences better serve people that with SUD as they're leaving residential treatment or as they're trying to get sober. And this is a study from back in 2006. I believe it was about 178 people, where some went to Oxford House and some just either participated in outpatient services or went home. And after 2 years, they found that half as many people who had gone to Oxford House were using substances versus people who weren't didn't go to Oxford House. That they had a 50% higher employment rate for people who went to Oxford House, and that they had a third of the reincarceration rate. And something that's not on this slide is that their average weekly income was actually double for people who went to Oxford House versus people who went back home. Now, lastly, how to find recovery housing. This is the biggest help for you guys. Now, we keep a list of certified recovery residences on our website, kyar.org, kyarr.org, which is that is the most up-to-date list of certified recovery residences. So how you can know on whether to send someone to a quality recovery residence is to go on our website, kyar.org, and see whether or not this operator is certified and how many houses they have certified. We also have the levels on there. We also have what forms of MAT are accepted at each residence, also what city it's in, what county it's in, and then also an admissions phone number. It is also a downloadable spreadsheet. I'm a huge fan of Excel, and so on our website, I wanted to make sure that we had a downloadable version of our directory that a case manager, like everyone on this call, could download, post on their walls, or just keep handy so they could refer people out without having to access the internet. We also support our friends over at the UK at the Kentucky Injury Prevention and Research Center, KIPRIC. They operate findhelpnow.org, which you can find treatment centers. You can find all the treatment centers in Kentucky. You can also find all the recovery residences. We do keep them up to date. We send them a list once a month. Uh, and then I also like to put on here, if you have a local recovery community center in your area, that is a great place to ask for opinions on recovery residences or where locally that they should be sending people. It's always good to get that from the baseline streets information. And then lastly, the Cabinet for Health and Family Services on their website, they also keep a list of certified recovery residences that can be accessed. That one's not updated as frequently. I believe it's updated quarterly as per the statute. So we do suggest that people go to kyr.org and find helpnow.org in order to find the most up-to-date lists of certified recovery residences. And then lastly, how to contact us. So we have a general information inbox at info@kyr.org, info at kyarr.org, and then my personal email address for Kyr is dane.preston@kyr.org. Not listed here is Bethany Kestner, our manager of certifications and outcomes. She also has access to the info@kyr.org inbox, and is happy to answer anyone's questions or help refer people out. And that is all I have for the presentation. I'm happy to open the floor for questions, and hopefully I can help everyone out.
All right, if you have questions or concerns or anything, raise your hand, put them in the chat or in the Q&A. We'll give everybody a minute to think about it. You covered a lot of information.
I know it's a ton of information. And I'm sorry. I hope it was digestible. We are happy. We also have a ton of written stuff on our website. We have 31 pages of certification guides that go into, we went through painstaking efforts to make this as accessible as possible for people who are seeking certification, so that they understand exactly what, thank you, Bethany, for putting our stuff in the chat there. to make this accessible as possible. We also have the statutes on there regarding recovery housing, also access to NAR learning modules that we're able to offer to people in Kentucky free of charge if anyone wants to uh, go through 20 hours of training on the NAR standards. We also have our code of ethics there. It's also, if you want to file a grievance against a certified recovery residence, you're able to do that through our site as well.
Can I get a copy of your slides and then I can email those out to everybody as well?
Sure.
Okay. We've got one over in the Q&A. Oh yeah, will you send us the PowerPoint? Yeah, I'll get that sent out to everybody. All right, any other questions?
And I know some people, if you have questions or questions come up, yeah, please do not hesitate to reach out to us at any of the email addresses that Bethany put in the chat there. We are here to help provide connection. That is the purpose of a NAR affiliate is to act as an advocacy and connection organization. As I said during the presentation, certification is only a byproduct of what we do. We are here to help represent the recovery housing community and help connect partners to each other.
All right, we'll wait another minute and see if any other questions or comments pop up. Yeah, just send me the slides and I will email those out to everybody that registered today. And I hope I had it set up this way. I hope that you all get a request for a survey. Please fill that out if you get it. We do take your comments seriously. Let's see, here we go. How long is the process to get into one of your homes? Okay.
So it will depend on the resident. So we don't operate any recovery residences, but we only certify them. So each residence will have their own eligibility criteria and own entrance process. Generally, it is that they need to have a certain number of days of sobriety. I know there's generally some leeway regarding THC just because of how long it can stay in someone's system. But generally speaking, um, it's a fairly quick process. If you call an admissions line and they have a bed available, they'd be able to get someone in the same day.
Okay. Anything else? All right. Well, I'm going to go ahead and end things, but I appreciate everybody showing up today, and we will get these slides out to you. And you now have a contact person. If you have questions that pop up later, you know who to reach out to. And I think Dane and anybody on his team can point you in the right direction. Dane, really appreciate you giving us some time today and all the information, the slides and everything. I think that this was a very valuable presentation today, and I hope that everybody uses these slides, refers back to them, and also know that this will be posted on the coalition's website, so you can come back to it and rewatch it or watch portions of it again if you feel like you need to catch something. So thank you very much, and Dane, just get me those slides.
I will.
Thanks so much.
Yeah, thank you, everyone. And if anyone is looking to connect to operators in their area, please reach out to us. We're happy to make personal connections as well.
Wonderful. Thanks so much.
Bye, everyone. Thank you for having me.